Dr. Dylewski with Texas Regional Urology. Wanted to talk a little about the decision-making process for men when they're diagnosed with prostate cancer. I don't think it's ever any man's best day when he finds out he has prostate cancer. And I see a large number of men either that I've diagnosed or see them as second opinions where they want to discuss treatment options in some more detail. I think the most important thing we can tell men when they're diagnosed is that you have time to think about things. No one should ever feel rushed or pushed. Prostate cancer, fortunately, is usually a very slow-growing cancer, and guys have time to think about it. I think there's three options that every man needs to be presented with. First, and maybe the most important option, is the option of active surveillance, or what used to be called watchful waiting. For a lot of men, we've learned that their prostate cancer is likely to grow very slowly, and it's unlikely to ever hurt or harm them. And there's a significant percentage of men who can safely watch their prostate cancer and actually not ever treat it. This obviously depends a lot on your age, your health, and some of the particulars about the type and degree of cancer a guy has. But I think a urologist is not doing their job if they don't present every man with at least the option of considering an active surveillance protocol. And we spend a lot of time talking about that in consultations. As a urologist, I'm a surgeon, and I do quite a bit of robotic prostatectomy work. For a lot of men, particularly younger men, this is a very appealing option because surgery does have the best long-term cancer control rate. In guys with low-grade cancer, this can approach 98%. Surgery does have some complications. There are some potential problems with surgery, including urinary leakage and erectile dysfunction that we go into quite a bit of detail when we counsel patients. However, the robotic technology allows us to provide patients with a surgery that gets them home the next day from the hospital, may have them back to work in a couple of weeks' time, and really feeling pretty good at that point. So for a lot of patients, particularly younger and healthier patients, surgery is a major consideration. Finally, radiation therapy has progressed a great deal in the last 15 years. And with the advent of computer-controlled IMRT, a more advanced kind of radiation that allows the radiation therapist to target the prostate, what we're seeing is better treatment outcomes and less side effects. For a lot of men, this will be a very nice option for them, something we'll talk about quite a bit. Radiation still has side effects. Radiation still has some downside that is very important to discuss with men. Impotence can still occur. Patients can have bleeding or irritation of the rectum, the bladder, or the prostate. After radiation, it can be difficult for patients because the prostate's been destroyed, and surgery is very difficult after radiation. And there's also a chance, although it's not a large chance, of developing a secondary cancer in the bladder or rectum many years after radiation therapy. Obviously, we have an array of ways to treat prostate cancer, and I think when guys get diagnosed, it's important to sit down with the doctor with whom you have a good relationship, a high level of trust and understanding, and someone who can speak to you very frankly about what the options are, what the pluses and minuses are, and help you weigh them so you can make the best possible decision. Every guy is going to come up with the best choice for himself, and that may be very different than the best choice for his neighbor, his cousin, his brother. Creating that individual decision-making process for a patient, guiding them through it, and helping every guy come up with his best plan of attack is really what we do, and something I really enjoy doing.